Okay. Hi, everyone. Welcome to Portland Cocktail Week Distance Learning on this lovely Friday. It's so good to see you all here again today. We are so grateful to have you with us today because we're talking about something really important. I have some really incredible people with me today from HEARD. If you have not yet visited, I want to make sure that I'm getting the website right, iheardyou.org. Go over there right now and check out the work that they're doing. But before you do, you might want to listen to some of the things that we're talking about today. So today we have with us Joel Rivas, who is the founder of HEARD, but we also have a couple of other folks who work at HEARD as well. Kristen McAdams is one of the coordinators who makes kind of all the magic happen here. She's going to talk to us a little bit about how all of the coordination and scheduling and how you can kind of get involved here at HEARD. And we also have Patricia Ryan-Johnson joining us, who is one of the counselors at HEARD. She's going to be telling us a little bit about what a counseling session is like and what to expect, what to bring, what you can expect if you do sign up and you do get involved. So I'm sure you all know, but mental hygiene is something that we in the hospitality industry are kind of notoriously negligent about, and we're really bad about managing it for a lot of reasons. I think we point to not having insurance. I think we point to not having time, not taking care of ourselves. But Joel and his team have taken some of those hurdles out of the way for you. HEARD provides free mental health care services to people in the hospitality industry. So there's hurdle one. And they're really easy to access if you follow the steps that we talk about here today. So I'm really excited for y'all to get to know this team a little bit. Before we get into kind of the quick questions here, I just wanted to encourage you all to get involved in the comments. This is an interactive session. We absolutely want you leaving comments. We absolutely want you asking questions. All of the questions that you ask in the comments, we're going to try to get to all of them. So please just get them in the comments. I have some amazing people. I know I've got my little spies in the comments who are writing them down for me, getting them over to me so I can ask these amazing people all of your questions as they come in. So please get them in there. And if you haven't already, please follow the page so that you can be informed when all of these videos go live as they go live. All right, all the housekeeping is done. Let's get to it. Joel, I am so excited to finally have you here talking to everybody.
Thank you for having us.
Welcome, Joel Rivas.
Thank you.
So Joel, tell me a little bit about HEARD. How did this all get started?
Sure. I've been in the service industry since I was 17. I started as a dishwasher and kind of worked my way through every part of the front of house and back of house, and bartended my way through college and those types of things. And then I had a 14-year career in healthcare, but even during that time, I also worked at doing consulting for restaurant operations and bar operations for people. And it was something that I had always been passionate about. It's where my heart has always been. And so at the end of 2016, when I left healthcare, I decided to focus on something that I was passionate about and that was giving back, and something that was bigger than I was. So I started Saint City Culinary Foundation, and our flagship program is called HEARD. And one of the things that I always saw was that there was a lot of people in the industry that had a lot of mental health issues and were suffering quietly. There were a lot of substance abuse issues. And so I wanted to create a space for people that could congregate together and get the help that they need and cut through some of the red tape of getting that help that they need. So we started in San Antonio doing support group meetings face to face, and that looked more like a peer support group type dynamic. And so we started that in San Antonio. We moved to Austin. We were in Houston for a bit, and then this year we were going to launch in Dallas and New Orleans, and because of everything, we've had to kind of pivot. But the main reason why I wanted a place for people in the industry, because it's a dynamic like no other. It's very much a family type dynamic and a tribe dynamic, and people are become extremely close and tight knit in the industry, and provide a lot of support for each other, and also provide a lot of negative aspects for each other as well. And mental health and mental health care is something that has not only had not been addressed as much, but there was a stigma surrounding it, and people were just, again, they didn't have access to care. They didn't know where to start when it came to care. Dealing with things like anxiety and depression and substance abuse were things that weren't really being addressed, and so they just like working sick. A lot of times, people just figured they needed to muscle through it. And what I want to do is create a space where people could come together and with like-minded individuals and discuss what was happening in their lives and the struggles they were going through, and the victories that they were having, but also connect them to resources in the community where they're at, where they can get that care. And at first, we also worked with a lot of people that have substance abuse issues. I'm an ex-addict, and I remember just not having that kind of group to talk to about those things. And if you went to an NA meeting, it was people that that came from so many different walks of life. It was hard to get in a group with people that knew what you were going through. And so we did that when we started HEARD. So.
Fantastic. I mean, I think some of the things that there's just so much incredible information in there, but I think the thing that kind of stands out to me is that in our industry, there is a difference, right? Like we are sort of a different group of people, and some of that is in the hours we work, some of it is in the mentality, some of, there's just a difference in our approach, sort of our overall approach to life, which then leads to our overall approach to how we take care of ourselves. So tell me a little bit about how you have approached people in our community and gotten them excited about, or at least mindful of, the idea of taking care of themselves. How do you approach somebody? How do you take that first step?
I think with anything like this, it's about building relationships, and it's we're very fortunate to have people in each of the communities that have owner operators, chefs, bartenders that have a large network of people that are friends with them, that they have stepped up and put the word out to those around them that this is something that is normal and it is something that is needed. And because of that, it has really helped normalize, mental health care, and has normalized wellness, which is something we always focus on. We're big on balance. We tell people that the balance is paramount. And for some people, balance looks different for everybody. And sometimes that balance is complete sobriety and getting clean. And sometimes that balance is just injecting a little wellness into their life, cutting back on the drinking and staying out late, going and seeing a doctor on a regular basis, doing some yoga, doing some meditation, and really, like I said, getting some levity to their life. Whereas most people that work in the industry they work till close, they get out of the bar at 3:34 in the morning, they go out to eat, they drink, they go to bed at 5:36 in the morning, they wake up at 2 in the afternoon and do the whole thing over again. And that's not a sustainable lifestyle. And getting people to realize that that's not sustainable, and that there are people out there that care for them and want them to live a balanced and healthy life, and live that life a little more full. And so so just communicating that, but having people in the community that have really stepped up and helped get the word out has helped normalize it, and for people that that come forward and get that help. So.
Absolutely. Well, one of those members of your community, Jarrett Peñas, who introduced me to you, and people like that, I think, are doing incredible work in getting the word out and normalizing how we talk about this as a community. And I couldn't agree with you more. I think the leaders in our community are really kind of where this starts.
Yes.
So how do people who either see themselves as leaders or want to be leaders, how do they reach out to you to start that conversation within their own organizations?
Just email me, Joel at saintcityculinary.org. Email me. You can find me all over social media.
I can attest. This man will text you back in 10 minutes. Not even 2 seconds.
I will. I will get back to you. We've as we pivoted, we've taken everything online, as y'all will discuss in a little bit, and what that has opened up are people from all over the U.S. have sent in requests for mental health support sessions, and owner operators have started, writing us about that. But we'll do anything we can. We will do in-services at your bar or restaurant with your team. We'll do individual sessions. We will start a support group in your city if you want to host one, and get the people there to help. So we are absolutely at people's disposal to help get the word out, and in the community, in the food and beverage community.
Fantastic. Well, you talked a little bit about the pivot, so let's talk about what's going on right now. Tell me a little bit about how HEARD has changed the way it works in the current era. What's going on? How have you changed? What's the new way of working?
Yeah, so we've taken what was a weekly support group, face-to-face support group, and we have shifted to make it available online. And for some people that are comfortable, they do it via Zoom in video chat. For some people, it's on the phone. But we have taken requests for people that want individual sessions, and we've had some people. We had people like Kristen, who has a gentleman by the name of Casey in Austin, connected us, and she's been absolutely instrumental in coordinating the care of different volunteers around the U.S. That have stepped up to help take those calls and take those video calls and talk to those people. And so we've shifted from a group dynamic, which we will be getting back to, and we're looking at July, and also made it individual, which we will also keep. We're not gonna do away with the online sessions, and just because we want to give people as many avenues as possible to talk about this and to talk about things that they're having, and so we're going to move forward with keeping the online stuff as we go forward.
Absolutely. I think that's fantastic. Before we go over and talk to Kristen about her work, because I think that's a great segue, I just wanted to ask you, how can someone help support the work that you're doing? Are there financial ways? Are there volunteer opportunities? How can somebody support your work?
Yeah, really 3 ways. First, like any nonprofit organization, we exist because people support us financially. If we don't have that, then we can't do the work that we do, and we can't exist. So that's a big part. Another enormous part is volunteering. Not only licensed counselors in different states that want to volunteer, but people that are interested in also being a peer support facilitator. Maybe it's someone in the industry that has the desire to be that peer support facilitator and start helping out. If there are owner operators that have, you know, a restaurant or bar that's doesn't open up till 5 in the afternoon and would like us, you know, in whatever city they're in, would like to host, you know, weekly meetings at their place. That's one of our biggest obstacles, is finding a place to host support group meetings on a weekly basis. And it's a huge help when we have someone that steps up and donates that space. And then the other way is just getting the word out. Just, you know, if you're on Instagram, follow us at HEARD_org, on Facebook, HEARD.org. If you see something pop up on your feed, if you regram it, if you can put it on your Instagram stories, whatever you can do, just getting the word out that we exist and that we're here for people is also enormous. I mean, we don't function unless we have people that are coming and getting that help. So those are 3 enormous ways that people can help us out and support us.
Absolutely. Well, you're doing incredible work, and I can't thank you enough. I need you to stick around, though, because we're going to have a lot of questions for you. I'm
Absolutely,
sure of
yeah.
it. But I do want to get to Kristen. Kristen, I want to talk to you a little bit about how somebody signs up, the process, and the work that you do. So, Kristen, are you here with us? Do I still have? Wonderful.
Yeah.
So, Kristen.
I went ahead and muted because I have 3 very large dogs that are very attached, and they're
very cute. I got a little preview of the pups. They're very cute. So very excited to see them peeking around the corner. So Kristen, give us a little background on you. Tell us a little bit about yourself.
So I am originally from Boston, Massachusetts, by way of Fort Lauderdale, Florida. Now I'm in Austin, Texas. I've lived and worked in the service industry. I say lived. I grew up in the service industry in Boston with a family-owned business my whole life. And then, used it to support myself in Florida and to support myself through grad school. I'm a mental health intern right now in Austin under Luminary Counseling. And yeah, I have a background in addictions work as well. And now I'm working more in private practice and using different modalities to help people in different ways. So.
Fantastic. Very cool. Well, tell me a little bit about the work you're doing at HEARD right now.
So I'm the volunteer coordinator. I was absolutely thrilled to connect with Joel. He's wonderful. HEARD is a really awesome organization, having worked in the industry for so long and talked to so many people who struggled and didn't know where to go or where to turn, or if there was resources available. I heard you mention, healthcare and insurance being an issue, and I remember feeling that very much coming up. And having this outlet now where people can come and get support fairly simply, very easily. And I do want to say, it's good to even just to go on the iheardyou.org and just check it out. Like, if you're up late and can't sleep and you're just curious, just go on the website and check it out, because even that one little step towards curiosity and self-care can be helpful. So what will happen is you'll go on the website, and then you can see the book a meeting right in the top left corner of the page, and you'll fill out the form. You'll give us a time of day and a day of the week that will work for you, the state that you're in, and then we'll send a request over to us, and then that request will be fulfilled by me or one of my team members, and you'll get sort of an introductory email, and then you'll connect with somebody. Super simple.
Fantastic. That does sound very easy. Excellent. So when somebody is putting in that request, do you need any special information? Is there anything that you're looking for in those requests, or is it just very straightforward?
So it's pretty straightforward. You just fill out where you're at, what day you're interested in, and then I will receive that request and I'll connect you with somebody. If you don't resonate with the person you connect with, that's fine too. You can resubmit, talk to me, we'll find you somebody that you do connect with. A lot of times people will continue weekly check-ins, and I've heard some really great feedback from the people that we've been working with, saying that just having that 45 minutes, 30 minutes, 45 minutes, sometimes they've even done 2 hours because we have fun. So it turns into this weekly thing, and it's a lot of fun, and people seem to really be benefiting from it. And it can be isolating right now. We're service industry, we're social people. We like to connect, we like to interact, we like to be doing things. And right now is when we need to actually go out and seek that support for ourselves.
Absolutely, absolutely. So when you're not working at HEARD, it sounds like you're also doing quite a bit of work in this space as well. So tell me a little bit about that work. How has that work changed in this era? Like right now, has it changed your work at all?
I mean, for me personally, in terms of mental health, it hasn't. I've always been moving towards doing long distance counseling. I think that it's really hard for people to find useful care if they're far away from a major city. You know, here in Austin, we have one of the most saturated mental health markets in the country. I think we're like the top 3. So we have lots and lots and
Good
lots
job, Austin.
of practitioners. Yeah. But it's hard if you live out in a rural area, or if you are in a different state, but you have, like, you know, I live in Texas. My mom has an inn in Vermont. You know, if people need help in Vermont and they don't know where to go and there's not a lot of resources, like being able to connect to somebody in Texas would be useful. So my focus right now is very driven towards crossing those state boundaries in an effective and confidential and within state guidelines type of way, so that people can easily and affordably and quickly get the access that they need to mental health care.
Absolutely. And I think that, especially with folks in our industry, and I'm sure in other areas as well, it's almost more important to connect with somebody who understands the demands on our lifestyle than somebody who lives around the corner. So I think this distance, you know, the distance doesn't matter so much as somebody who is willing to understand the demands of the lifestyle, right?
Yeah, and like Joel said earlier, you know, just finding that community that connects in that way. You know, you can connect with one of the thousands of therapists here, but they may not be your style or your vibe or your jam, really. And my whole goal is that you find somebody that you really resonate with and connect to. And I think that that's the most important thing that you can find in mental health.
Yeah, absolutely, absolutely. So when you're matching people up and trying to find you know, that resonation, is there like a secret formula, or are you just trying to find, you know, is it based on anything in particular, or are you just kind of experimenting? Like, is there a Kristen magic to it?
Well, in terms of working with HEARD and having the submissions come in, I don't necessarily know who's requesting a session. I do know my team, and I do know who's available and when, and I will connect them that way. But like I said, if people want to take it more personal and they want to email me, I've had people email me directly. You can do that. It's Kristen, Kristen, at mysoundingboard.co, and I'd be happy to personally fit somebody with you.
Awesome. That's very cool. Well, thank you. That's amazing. I'm certain I'm going to have questions for you too, so hold tight. We will be right back with you. Patricia, you're next up. I want to talk to you a little bit about what happens in these counseling sessions. So next up is Patricia Ryan-Johnson, who I'm sure you all can guess, just kind of based on seeing our faces next to one another, is my mother. And also a brilliant licensed social worker and counselor for many years. I'm not seeing your face yet, so I'm guessing you're either on mute or maybe we lost you. I think I hear you. There you are. Hi. Excellent. So Patricia, tell us a little bit about the work that you've been doing at HEARD. And well, actually, before you do that, tell us a little bit about your background. I think people would really love to hear a little bit about that.
Okay, I've been a licensed clinical social worker in Manhattan and on Long Island in New York for the last 20 years, and worked a lot in emergency departments with substance abuse individuals that were suffering substance abuse issues, depression, anxiety, and really in the moment kind of crisis counseling. So I've had a lot of background with that. I worked on a psychiatric unit for a while, and then for the bulk of my career, I worked at NYU Medical Center in New York with children that had cancer. And so that was outside of the hospital. It was really a very psychotherapeutic environment where I met with patients that were suffering with cancer and their parents, and I ran groups and individual sessions and a lot of emotional support, as you can imagine, that kids and families need going through a cancer diagnosis. So, and while you're going through that, you run into, you know, homelessness and substance abuse, like all the mental health issues come rolled up in that too. So it was a very exciting, I felt very honored to be able to do that work. And then from there, I opened up a private practice also and did supervision of other clinical therapists, gamut, you know, doctors.
Did it all.
Yeah, nurse practitioners, like everybody. But I was very honored to be introduced to Joel and Kristen and the HEARD Foundation through this COVID time, because it was a new population. Although I do know Lindsay, of course, you know, she's my daughter, and like I have access to your community. Myself, I wasn't immersed in this community, and it's been a true honor to get to know people that work in your community. The people that I work with, I would say they are brilliant. They have overcome obstacles which are monumental, some of them. I don't want to get emotional here, but they're really amazing people who have done great work in life. And they're caregivers, right? They're the ones, they're used to taking care of everybody else in their life and in their work. And so when it comes to them, they're not so used to being caregivers to themselves. And so I think this COVID crisis has given us a little bit of a silver lining. I'm able to work across state lines now because the executive order was changed from just doctors and nurses. I work very hard with the governor's office, the White House, the secretary, everybody in the government here to try to get that extended to mental health providers. And we were able to get that changed to include mental health providers. So now I don't have to only see people in New York, but I'm able to see people from the HEARD Foundation all over the country, which has really been a blessing to me. And I hear a recurrent theme with these people, and it's that they can't find a therapist. They can't find anybody, let alone good. They just can't find anybody to return their phone call. They're not taking their insurance. The fees are astronomical. It's just like a whole plethora of reasons that are obstacles. And these are people that are used to being caregivers anyway. So at some point I feel like they say, well, this person needs my help more than I need help. So, you know, I'll put this on a back burner. But with HEARD, I think Kristen has made it so easy for people to just send in their name and phone number. And what day would you like someone to reach out? And I think it couldn't be easier, and it's seamless. And I really want to encourage people to do that because it's really been wonderful.
Absolutely. Well, thank you for all of that, because I think we definitely need to take a minute as a community and think about ourselves, because what you're saying is what I've seen for the last 15 years. And so much of my work is rooted in trying to take care of people who never have anyone think of them. They're always thinking about everyone else. So I hear you completely. And I agree with that sentiment. So let's talk a little bit about, let's move into what people can expect during these sessions, because I think for a lot of folks, me included, I think there's a little bit of like anxiety or a little apprehension. Oh, what's going to happen in a counseling session? What do I need to know? Can you talk us through what happens in a counseling session? What should people expect?
I can, and I have a whole presentation, but I'm just going to speak to you from the heart because I think that resonates better with people. Keep that up. I might refer back, but you know, really what it is we care about you. So you're going to be talking to someone who cares about you first and foremost, and to get to the root of the problem, like what's going on. So the first way we do that, right, is we meet you. We let you know that it's confidential. Whatever you tell me goes nowhere else. I do take notes, but nobody sees them. Unless you tell me you're going to kill yourself or kill somebody else, no one's going to know what we discuss. It's totally private, and it's safe. It's a safe place to get your concerns, your issues, your longings heard. Hence HEARD. That there's a time we're going to meet. You know, the people that I've had the pleasure of working with, we've continued, every one of them that I met, I continue to work with weekly. And I think that's going well. I think that works for everybody. During the COVID crisis, the executive order allows me to do that. I have to work with Kristen and Joel to see like when that ends, how we're going to address this. We set parameters of the support session. There's limits of a support session. And we're meeting online, right? Which is different than meeting in person. And we talk about all that. And the next thing we do, once that's all out of the way and people are feeling safe and comforted and supported, then I like to do an assessment. And we take, all kinds of demographic information, like, where did you grow up? Where do you live? How many siblings? What's going on in your life? Where do you live? All that kind of stuff, just to get a feel for where you are now. Right?
Mm-hmm.
Then we talk about what led you to take this step, like what's going on for you that you'd like addressed. And we talk about feelings, how hard is it for you to make this call and actually talk to a stranger and tell me, how you're feeling and what you need help with. And it's hard. It's I'm going to be very honest, it's very hard. Even though the referral's easy, getting the person is easy, whether you're through HEARD or anywhere else, like calling someone and pouring your heart out is not the easiest thing to do for anyone. But I think when people feel supported and safe, they feel like this, I've got to just say it. And we have ways, to help people say that. And we let them know it's a stressful time, right? Some people, will tell us then, I've lost a loved one to COVID. So there's a bereavement process, luckily I haven't had many of them. And, that's a really tough thing. And I am not a bereavement specialist. So if I did get somebody like that, I would make referrals to the community to bereavement specialists. But the sense of loss of security on so many levels right now, like we have it, people have lost jobs. The unemployment rate is way up. They've lost their routine in life. When they get up in the day, they used to wake up, take your shower, eat, get your coffee, run to work, whatever your daily routine was. That no longer exists. It's different now. The loss of income, loss of your social support network is really a hard one, especially like Kristen was saying, in your industry and really in every facet of life, people are connected to other people. You guys seem to be more connected than other people I've worked with, which I kind of assumed, but it is really true. And it's hard because when you're isolated, it's hard to feel connected. So we talk about ways of reconnecting. And then lastly, I do want to bring up today, without crying, but I want to bring this up today. I think it's really important to talk about this racism and the loss of life that's going on right now and how people are dealing with that. It's really, really hard and it's really bad and people feel a tremendous loss, and that's been really hard because on top of everything else, now you have this loss of, human life. And that's something I'm going to table for now, but I am a social worker my whole life. I mean, I feel very strongly about this and it's really difficult. But all of the therapists that work at HEARD are very open, caring, supporting, non-judgmental people. You could feel free to call in and let them know how you're feeling, and you're going to get help. You're going to get some level of care. And I think that first initial step of caring is really important, just to know someone's out there for you and you're connected to them and they're connected to you. I happen to be very attached to the people I work with. It happens, it's really a dynamic situation. We acknowledge it's a time of crisis. It's confusing. It's upsetting to everybody. And then, like I said, this personal crisis among a global crisis, among the racism, it's all mixed in and it's difficult. So we encourage people to talk about their feelings. Sometimes, we have to tell people, because these are people, right, that for the most part have not been in therapy before. At least in my experience at HEARD, these people have not been able to access mental health before. And so sometimes they don't have the language that we use, even to describe feelings, which is difficult too. So we talk about that. We talk about what this means to you, describe how you're feeling, but we don't label it. Like, what does that mean for you? And that's been very significant. So we provide psychoeducation so we can define their concerns then analyze the issues and come up with vehicles that we can work through to produce the best outcomes for people. And that's been really helpful. We tell them how to do social support, how to engage with other people during this time, how to engage friends, family, neighbors, using FaceTime, Zoom, and really anything we can that's safe. Then I always talk about healthy behaviors. Are you getting enough rest? Are you exercising? Do you limit social media? Because social media can be really positive, but right now it can be very strongly negative, and we have to kind of balance that. And distress relief is very important, providing referrals to appropriate levels of care. If somebody calls and says, you know, they're in great mental health distress, I'm not the right level of care for that person, but I need to work to make sure that person gets the right level of care and gets it quickly. We talk about building resilience, and I'll get into that in more detail. And then, you know, we have, for the people that have greater needs, like I said, we would see them weekly. And if I think they need more, I mean, I've been doing therapy with people for many, many years. I feel very comfortable, you know, giving them counseling and support. I do provide everybody with the National Suicide Prevention Hotline, and I think Brittany will share that. It's 1-800-273-8225. I'd like everybody to have that number, whether you need it for you, a friend. God, I hope you never need it, but if you need it, I hope everybody has it in their wallet and can access it. It's free. It's literally a lifesaver. Then we talk about, you know, physical needs, personal hygiene. Do you have a place to live? Where are you sleeping? You know, that kind of thing. And if they need that, referrals go out. Like, this is what we can do. You know, someone, let's see, I don't want to go into anybody in particular. Then we talk about effective coping. So I talked a little bit before about maintaining a routine, the time you get up in the morning, when you do your activities of daily living, the time you eat your meals, when you go to bed, and then there's sleep hygiene to do if you're not sleeping well, physical exercise, relying on good experiences. Memories are very helpful for people that have been in isolation for so long. Pictures, videos. There we go. That's my whole list. Maintaining a journal. I have a lot of the people I'm working with maintaining a journal. And I always ask that we write down 3 gratitudes every morning and evening. And I actually would like to stop here now and see if everybody who, including all of you, Lindsay, Joel, Kristen, everybody, Leo, whoever's there, Brittany, and Liz, if you, everybody, please write down 3 things you're grateful for today. Just today. They could be little things, like I had a really good sandwich. It doesn't have to be, you know, monumental, just anything that you're grateful for today. And some people are really open about wanting to share their gratitudes, and I ask people to do this every single day, because research shows that after 6 weeks, it actually does start to make changes in your brain, and you will become happier in your daily life. It's very important. So it's a simple exercise, and the people that I work with do find it helpful to start and end your day that way. And then, you know, we always look for risk factors, like, you know, suicide. Is there a talk of suicide? Is there a plan? Is there a thought? Is there an action? And if there is, that of course is outside my scope. I would refer them to the prevention hotline if there was a thought. But if there's a plan, we would recommend the nearest ER. And domestic violence, unfortunately, with COVID, it's people have been in the house with people they haven't been around for, you know, 24/7 for maybe ever. And domestic violence, unfortunately, is increasing. So there's a domestic violence national hotline that I think everybody, again, should have this number in your pocket in a safe place where no one can find it. If you need it, you can access it and get out fast. I think, you know, as a nation, we underestimate domestic violence. You know, some red flags are, you know, someone who doesn't want you to have friends, someone who doesn't want you to contact your family, someone who likes you all to themselves. You know, these are red flags, they're warning signs that something's not right. Keep that number. And of course, there's substance abuse. Like Joel said, I love the way Joel put this. You know, we can assess and evaluate someone's substance issue. We cannot and do not say, okay, it's time for you to get rehab. It's time. No. We meet people where they are. We help them with what they're comfortable being helped with. And we infuse some wellness practices into their daily lives. How about yoga? How about meditation? How, gently, what they're comfortable with. So it's a win-win for everybody, right? Because when you're doing wellness, it encourages you and inspires you to maybe let that go a little bit, because most times people are using substances to self-medicate. And so if we can get you to feel better through talk therapy, through wellness activities, maybe that need won't be as great. Of course, there's an addiction issue, and we're not going to go into all that. Then there's depression. We talk about, people having feelings of mourning if someone's died, or even people mourn more than just when people die. People mourn the loss of a job, the loss of a spouse, the loss of a girlfriend. Anything could be mourning for anybody. We never judge someone's mourning, and everybody mourns in different ways. People feel helpless, hopeless, especially right now, again, with this, what we have going on in this country with the racism. People are feeling really helpless to change the situation. And it's a huge, huge, huge situation. We're all dealing with that. So, but any emotional symptom that's causing them harm or interfering with their daily lives activities, we're going to work with and hopefully help, even if it's just a little bit. So in closing, the themes of support sessions are, we summarize for the person what happened in the support session. We provide appropriate reassurances. It's a hard time. We let them know that they're experiencing painful, uncertain days, and with the reopening of each state, it's challenging. But we let people know most people are resilient and, will bounce back over time, but that it's okay if you don't, and some people don't. And then that's okay. We refer you to another level of care or to one of us and continue seeing us for therapy and support. But we're always able to, provide information, resources, and referrals, and, reconnect if needed. So
Absolutely.
It's a thoughtful, thorough system.
Absolutely. Well, thank you for sharing all of that. I think that gives us all a lot more context and a lot more information, so that when we walk into one of these sessions or dial the phone, there's an understanding of what's going to happen, and you can be a little bit more mentally prepared. And also, none of that, while some of it sounds like it's going to be work, it doesn't sound particularly scary. This is all work that we can do, and it's work that is ultimately just going to benefit you. And it's work that we all need to be doing so that we can all get into that better place where we're feeling just a little bit better about things in general. So thank you for all of that. That was incredibly helpful.
It was very long, but I just wanted to get as much in so people have as much information as possible.
Well, I appreciate that. And your co-host Daniela is doing a great job.
Thank you.
Well, we do have a couple of questions. I'm gonna actually start with a comment because it is directed to you, Patricia. Anna Welker said just wants to thank you for this. She says that your words are making her tear up because they are so on point, and she wishes that this space had existed 5 years ago, and she really appreciates that it exists now, though, for bringing this to light in our industry. So people won't feel as bad as she did, and she's just very appreciative that this exists and for your time today. So thank you for that.
Thank you, and I'm very appreciative
thank you, Anna.
that I get the chance to do this.
And we love you, Anna. You're wonderful. Anna had another question. This one is for Joel. Joel, in regards to your call for how to help, we and a couple of others started a mental health Zoom group that sounds very much like the early stages of what you're doing, and she would love to see if there's a connection to be made. So what I'm going to do, this isn't a question, this is just an email, but I'm going to write to the two of you because I love you both and I know how to do that. So that's easy. That is a to-do for me and nothing for either of you. So nice and easy. And then here's one more for you, Joel. You mentioned something about starting a HEARD meeting in your city. So how you get in touch is that email, which I'm going to pop your email in the comments here.
Perfect.
Awesome. But actually, can you say it one more time? And Brittany, Liz, if you could just
Sure.
type away.
Sure. It's Joel, Joel, at saintcityculinary.org. Saint City is Saint is spelled out SAINTCITY culinary.org.
Amazing. And I think these meetings are, obviously there are a lot of folks asking specifically about these meetings. When folks are thinking about setting these up, what are some of the kind of, other than talking to you, what are some of the first steps that folks should think about taking to get those going?
Sure. Like I mentioned earlier, one of the biggest obstacles we have is finding a host space. A space that is being unused usually during the day is a good time. Something that's usually available without a lot of background noise or music going on is helpful. And because our support group meetings are discretion is paramount, something to where it's you know, if it is open, if the establishment is open, there's a private room or something like that that we can use as well. So that's the first thing to do. And then also those that are interested in being a peer group facilitator for those support groups. And in some places we have, you know, 2 or 3 people that will take turns. Just that the people that are interested and that we'll talk to and get trained on what to do, just that they are ready to commit to, you know, once a month or twice a month to do this. And it'll always be a particular day that we'll do it, a particular time in a particular location for consistency's sake. So those are, you know, those are kind of 2 big things. And then we can work together in handling, you know, the rest of it and getting the word out. And any materials we need as far as like cards. We have these little business card size that say HEARD, and it has our information on the back, and we leave those around. We leave those in like service industry bars that people hang out at. We leave them in like in different areas. People will leave them in there, and when they're paying their check at a restaurant, and leave it in there with their tip for whoever the server is, just to get the word out. So we'll send all of that over to whatever city is the starting one. But yeah.
Very cool. The work that you're doing is just fantastic and so monumentally important. I can't thank you enough for getting this started and continuing following through and taking such good care of all of the people who we care so very much about. Joel, any final thoughts as we're kind of wrapping up here today?
Sure. First, it's again, I want to express gratitude for our team, Kristen and Patricia, just how amazing y'all's heart and souls are and passion for this sort of thing, and for giving back to a demographic of people that, like Patricia's saying, they're givers, and a lot of times they give too much and never expect anything in return. So I'm very grateful for them, and just that. I want to work together with, if there is someone that has started this in the city or wants to kind of more, you know, put some, you know, foundation down and just make it more adhesive. You know, we definitely want to work together with different groups like that. And Lindsay, thank you so much for giving us a platform to talk about this, and Portland Cocktail Week and Lush Living, yeah, this sort of thing is paramount to what we're doing in getting the word out. So thank you.
Well, we appreciate y'all so much. Thank you so much to Joel, Kristen, and Patricia. You're doing amazing work, and I can't wait to actually give you all hugs when I see you in person, which I hope is very soon, and I hope I'm allowed to do it very, very, very soon. Thank y'all for the work you're doing.
Thank you so much.
Have a great weekend, everyone.
Thank you. Y'all too.